There are several different components to the nebulizer. Obviously, first off, you have the actual air compressor itself, and then you've got the cord that's attached to that, and here is the on and off switch right here. And then this is the tubing, and this delivers the air that makes the whole machine work. And I will mention probably a few times throughout the series that it's very important that you keep this tubing dry. You don't ever want to put any kind of water in it. And then over here we have some of the various different pieces that help the medicine actually go up into the lungs. Here's an example of a place that you would put the liquid medication. It would go in here underneath, actually goes underneath that cone there. And then you would seal that together, and then you've got the tubing here, and then depending on how the age of the person that is using it, you're going to use different kinds of apparatus to actually put on their face. Like this is the mask right here, obviously for use with a young child. The dinosaur, they have different kinds that will help enhance the child's experience in using the nebulizer. But for younger children or people that just aren't going to tolerate the mask, to put the pieces together so that they're not actually having something connected to their face.